Is relapsed Ewing sarcoma hard to treat? When it comes to relapsed Ewing sarcoma, many people wonder just how difficult it is to treat. The truth is, relapsed Ewing sarcoma is generally considered hard to treat, and the outcomes are often not as favorable as they are for the initial diagnosis. After a relapse, the prognosis can be quite challenging, with treatment success hinging on various factors such as the timing and location of the relapse, how well the cancer responds to chemotherapy, and the use of aggressive treatment strategies. Ewing sarcoma is a type of bone cancer that primarily affects children and young adults. When this cancer returns after initial treatment, it creates significant hurdles for healthcare providers and patients alike. Survival rates drop considerably after a relapse, with studies indicating that the 2 to 5 year survival rates post-relapse are often below 25%. For example, one analysis found that the 2-year survival rate was about 23.5%, while the 5-year rate was only 15.2%. This highlights just how tough it can be to achieve long-term remission after a relapse. Several factors can influence the outcomes for patients with relapsed Ewing sarcoma. First, the timing of the relapse plays a crucial role. Patients who experience a relapse later, particularly more than 18 months or 2 years after their initial diagnosis, tend to have better survival outcomes compared to those who relapse earlier. For instance, the 5-year relapse-free survival rate can be around 35% for late relapses, while early relapses have much lower rates. Next, the site of the relapse is also important. If the cancer returns locally, meaning it is confined to the original tumor site or the lungs, the prognosis is generally better than if it spreads to the bones, bone marrow, or involves both local and distant sites. Patients with local recurrences who undergo radical surgery often see improved survival rates compared to those who do not have surgery. Another key factor is how well the cancer responds to chemotherapy. Patients who respond positively to salvage chemotherapy and then receive high-dose chemotherapy with autologous stem cell transplantation have shown improved survival rates. Some studies report 5-year survival rates of up to 46% in patients who respond well to chemotherapy. Conversely, those who do not respond to chemotherapy face very poor survival outcomes. Lastly, the use of aggressive multimodal treatment can improve results. Combining intensive chemotherapy regimens with local treatments like surgery or radiotherapy at the time of relapse tends to yield better outcomes than using chemotherapy alone. High-dose treatments, including stem cell rescue, have shown promise for selected patients. Despite these strategies, consistent cures remain elusive for most individuals facing a relapse. The disease can often be fatal after the first relapse, making personalized treatment essential. This means balancing aggressive therapies with considerations for quality of life, as salvage treatments can come with significant side effects. In summary, relapsed Ewing sarcoma is indeed hard to treat due to its aggressive nature and limited effective options after initial therapy has failed. While improved survival is possible for some patients through aggressive, multimodal approaches, the overall prognosis remains poor. This underscores the importance of ongoing research and the need for individualized care tailored to each patient's unique situation. Always consult healthcare professionals for personalized medical advice.